Welcome to our presentation on harnessing artificial intelligence for innovative healthcare delivery, a practical hands-on workshop that was delivered at the 17th Biennial Conference of the Association of Lady Pharmacists in Enugu on Friday, 15th May 2026. This is the recorded version for the purpose of catching up with whatever you have learned, and perhaps you have missed up on some things, you will learn more. Okay, so this will be about an hour to an hour and a half to cover everything without any interruption. So I would say get your notebooks, get your jotters, get your devices ready, and take action or implement whatever it is that you need to implement during the practical sessions. But for now, pay attention. Let's go through out the workshop, the slides, and you will learn what it takes to deliver innovative healthcare to your patients, in your practice, and everywhere you are using artificial intelligence. So, who is me? My name is Gabriel Gambo Umadum. I'm a pharmacist like you. I'm also the founder of AI Mastery Academy. AI Mastery Academy is our edtech platform where we teach professionals, business owners, and even general individuals AI skills, AI knowledge that they can use to increase productivity, improve efficiency, build their business and get their business to grow beyond whatever it is. And most importantly, make extra money for themselves. And for us pharmacists, we also have our EdTech innovation, which is actually uh, a company that is focused on empowering healthcare professionals with tech and digital skills. So we are operating AI Mastery Academy under EdTech Innovation for healthcare workers. Okay, we are based in Kaduna, Nigeria, and I want to believe that we'll have a nice time together in this workshop. So one or two things about me: I'm a pharmacist, I'm a supply chain professional. I work in the public health space for over 20 years now. Be also an health system strengthening specialist with particular interest in digital health innovations across Africa. I'm a researcher. My area of research is AI in operation now and supply chain management. I'm also involved in AI for digital entrepreneurship. This is where I empower people to learn how to use AI to start online businesses, start digital businesses, as well as make money for themselves using digital platforms and online platforms. I'm also a speaker, a AI consultant, educator. I've spoken on several different platforms across different nations in Yaoundé, in Nigeria, in Ghana, in Benin Republic. And of course, I'm an advocate for digital income. I mentioned that earlier. And especially for pharmacists, it's my desire that all pharmacists can make money online because we are more than what we are actually doing. We can do more than just being in the clinics. We can do more online. We can create courses. We can create ebooks. We can create consulting platforms. We can become more than what we are doing now. So I'm an advocate in that area, especially making money online. And of course, I'm an AI evangelist. My desire is that everybody uses AI to do their work. Of course, use it using it ethically. I'm an advocate for ethical and responsible AI use. However, I believe strongly that AI can change a lot of things about us in Africa, as it were. We are backward when it comes to AI. Not backward in terms of not enlightened, but at least we have a long way to go to catch up with those in the advanced countries. So that's that about me. Africa doesn't have an AI access problem. We have an AI trust and skill challenge. So if we can solve that problem through AI Mastery Academy, through EdTech innovation, then we can get everybody in line. So now let's see what our agenda for today. So we'll be looking at AI fundamentals so that we understand what AI is, how it works in healthcare. We are going to look at AI in pharmacy practice, the real world use cases for pharmacists. We're also going to do live demonstration and practical exercises. Then we'll look at ethics and responsible AI use, where we are looking at safety, biases, and patient trust. Then we'll look at action plan and if we can, take some questions, okay? We'll look at how do you move in the next 90 days to adopting AI in your practice, okay? So part one, understanding AI in healthcare. So let's build the foundation. So what is artificial intelligence? I like to use simple description, simple explanation so that people get to understand it. I don't need to bring dictionary meaning or all those ones are full of big vocabularies. So when machines simulate human intelligence, that is what is called artificial intelligence. So what it means, therefore, is when machines are doing what typically humans do, then that is artificial intelligence at work. Okay, so I talk, computers can now talk. I hear, computers can now hear. I see, computers can now see. There's something called computer vision. Okay, I feel, computers also feel. I mean, feeling in terms of touch. Now, there's something that differentiates humans from other animals and inanimate things, the capability to think and reason. Now, computers can think and reason. Okay? You can learn as human being, computers also learn. And one of the things you do from morning till evening every single day is to solve problems. Now, computers also solve problems. That is artificial intelligence. It's as simple as that. Okay? Artificial intelligence is not an alien. I was online someday and somebody was saying, what is AI? The person said, alien intelligence. No. Artificial intelligence is not a spirit. You know, some people who are so religious know that there's God, there's devil, and there's artificial intelligence. No. Artificial intelligence is just computer. The computer we use, if you have a way of setting up something on your own laptop, your laptop can become an AI server where you can train it to do a lot of other things that artificial intelligence are doing through the platform that we have. Okay, it is just machines, computers. Our drone is a computer. Our robots we use are computers. Driverless cars are also computers and everything doing what humans regularly do. For example, in the case of driverless car, cars drive themselves instead of human driving them. That is artificial intelligence at work. Then we have other areas related to artificial intelligence, something called machine learning. This is when systems are able to learn pattern from data without actually being programmed. Now, I don't want to go deep into this. For computers to work, for some systems to work, you need to program it. However, for machine learning, of course, they've been set up in such a way that they see pattern, they learn the pattern, and that pattern will guide them in reasoning on something else. So you give data, they look through data and come up with interpretation of data and so on and so forth. Okay. Then we have the natural language processing. Here, AI understands and generates human language in form of text, speech, and conversation. And generative AI, which we actually use, ChatGPT, Claude, and their likes, fall under this natural language processing. Okay. But they are called generative AI because they generate text, generate images, generate video, audio, and so on and so forth. Then we have computer vision. This is where AI interprets images. For example, X-rays, scans, pathology slides, prescription. These are applications in healthcare. So you can get an X-ray image and put it to AI, and AI can read it and interpret it for you. You can give it scans, pathology slides, and all the, even your prescription. It can view your prescription and say something about the prescription, even without you typing it in. That is computer vision. I think this gives us an overview of what artificial intelligence is, and we can just have this brief understanding. Okay, look at it as it is. You will see that artificial intelligence is a helper. It's not here to replace, it's simulate. Now, I tell people that artificial intelligence or technology itself is inanimate. Whatever tool, chat, GPT, robots, drones, all of them, unless a human operates them, they remain where they are. So when people are afraid that AI is coming to replace people, no, AI will not replace anybody because they are inanimate, they are lifeless, they can't do anything. But somebody who uses this technology will replace the person that doesn't use it. So in essence, the replacement is not as a result of the technology existence. The replacement is a result of somebody using the technology to do the work. So when two people are doing the same type of work, one is using technology, the other one is not using, the one that is using technology will overshadow the one that is not using it. And what it means is when there's a time for recommendation or it needs somebody that has expertise, this person who uses technology has an advantage over the other person. That's where replacement comes. The person using technology may even be more productive. Not me, will even be more productive. So the person using technology is able to do 3, 4, 5 people work at once, while the one using not using technology is even struggling to do his own one person work. When there's a need for downsize, they remove the one that is not that productive. So you see where the replacement comes. Replacement does not come because technology exists. Replacement comes because somebody is using something that the other person is not using. So if you don't want to be replaced, when I spoke at NAFDAC event last year, I told them how to make yourself irreplaceable. And how do you do that? By imbibing this skill, by picking up this skill to yourself and using it in your daily work. So you become more valuable, you become more productive, more efficient. And of course, your organization will love you more for it. And even yourself, you are going to gain a lot more from it because you are able to do much more with less stress, as it were. So, how is AI in the healthcare landscape? The global market is about $45 billion and it's still growing. And in a study that was done, 6% of healthcare executives are already piloting AI in their organizations. Of course, this study was done in the West, not here. I'm sure when you do the study here, we're going to have a small number. Now, you that is watching this video, you will have to be in the number when a study is done here in Nigeria so that you can use to enhance your practice. Now, what is the result of even some of the study that was done? 30 to 40% reduction in diagnostic errors have been reported with AI assistance. So when you use AI, you reduce error as much as 30 to 40%. We are humans. We have the propensity to make mistakes. We are not able to remember everything. We can forget something. We can, in course of doing our work, we can do error. We can bring error into the work we do. But with AI, that error is reduced drastically of up to 30 to 40%. That's massive. Okay. Now, in which area is AI used in healthcare? Drug discovery, clinical decision support, patient monitoring, medical imaging, medication management, predictive analytics, administrative automation, patient engagement, genomics, several different areas. These are just about 9 of them. And of course, there are a lot more where it can be used. As pharmacists, drug discovery is our own scope. We can use it. Clinical decision, because we also advise in those areas, we can use it. Patient monitoring, medical imaging may not be in our area because it is we don't do much in this area, but in the general healthcare is useful. Medication management is your own turf. Okay. How about predictive analytics? You have data, a lot of data. You can use it to bring about decisions. You can use it to come about insights, as it were. You also into administration. You can automate administrative work. You attend to patients. You can help with patient engagement. Genomics is a science area where all of us, one way or another, we are involved in. We can go into that research and use AI in it. So why is it important that we should pay attention to AI? Healthcare is under pressure. That is the main thing. Especially in Africa and of course Nigeria, where we have shortage of manpower. We have under a lot of pressure. Okay, so there's a rising patient expectation. Information is overload is also a problem that we are facing because new guidelines keep coming, there are new updates coming, clinical evidences are being published faster than any professional can absorb them. Of course, we are intelligent beings. We are able to study, we are able to read, but how many can you read? Let's ask ourselves, in the last 1 month, how many journals have you read? How many new drugs that have been released have you read about them and imbibed them that today, if they ask you, you can talk about them? How many studies that have been done even on existing drugs? What have you read about? So there's a lot of information that you may not have access to. Okay, that is also the part of the pressure. The workforce burnout. I don't even need to repeat this because this is something we experience daily. Very few pharmacists in the hospital, but a large traffic of patients. So many patients, high volume, but you don't even have enough time to do your work. The standard practice is pharmaceutical care, but you're not able to do it as much as you should. So you give a patient that you have spent 15 to 20 minutes with, you spend 3, 4, 5 minutes, and the patient is gone. Another one is coming in. You also get burnout. You're overworked. Okay? Then, of course, you don't even have time to do your own education. I know a lot of people that are doing the West African program. When it's time to write all those exams, they are now rushing and everything. because there's a lot of workload. They don't even have enough time for themselves. Okay, so you see the lot that is on us as healthcare professionals, as well and particularly as pharmacists, which is loading on us. Okay, so if we must overcome this, then we need help, and one of the help that we can use is artificial intelligence. Okay, so AI is not a trend. It's not something that is passing. It's something that has come to stay, and it is a way in which you can respond to this pressure that you feel as a professional. Okay, so as a pharmacist, why is are you positioned to lead AI adoption? There was a study I read, one in Pakistan and one in Nigeria, I think by Odewale or so. And pharmacists are at the forefront of AI adoption. In actual fact, specifically in the Pakistan study, the highest number of professionals who adopted AI are pharmacists. Okay, even in the Nigerian study, Nigerian pharmacists are also in the forefront. Okay, so what it means is you are already prepared for it. If you have not adopted it, your other colleagues are doing it, so you should quickly join them. Okay, now you are also a medication expert. You are expert when it comes to drug. You bridge between prescriber, patient, and the system. So you are already trusted. There was a study I was doing in the US, and pharmacists, I think number one, number two, I think number one, the most trusted professional. So you already fall in that category. So you have expertise in medication, you are gatekeeper of data because you have data. You have been trained to take safety very, very important. You are precision. I mean, that is evident in our dispensing, isn't it? Okay. And like I said, patients already trust you. So if you have all these categories or all these credentials, what does that tell you? It means you are very positioned that you can lead this AI adoption. And I want to say from now henceforth, if you have not actually imbibed it as much, you should start doing that so that it can build up on your skill and, of course, lead the process. So now look at part two. Let's look at AI in pharmacy practice. Let's look at real application and real impacts. Okay? All right. So where can AI be used in pharmacy? Number one, we can use it in medication management. I mentioned that earlier. So that we can have safer dispensing every single day to every single patient. So with AI, you can identify drug-drug interactions. You can detect them. You can detect drug-food interaction. You can do a lot of those things, which already you have been trained about, but because we said there are new updates every time, there are new information every time, you are not able to have all of them at your fingertips. Where you have doubts, where you have challenges, you can use AI to quickly solve the problem for you. AI has the capacity to screen thousands of combinations instantly and flag interaction, many times faster than humans can do. And if you're under pressure, you are likely to miss some of these interactions in the drugs that have been prescribed, especially where we have massive polypharmacy. Sometimes some patients come with 5 drugs, 6 drugs, 7 drugs. Okay. Then, how about adverse event prediction? You cannot tell whether a person will have adverse effect by looking at the person. But when you see one or two things about the patient history, you can flag it up. Okay. Now, with AI, it becomes faster. Even something that you're likely to miss, it can help you to quickly flag it. So you can know whether a patient has a tendency to have reaction. Okay? How about prescription fraud? There are places that you begin to see different types of prescription that when you look at it, you begin to think that something is wrong. I remember when I was doing my youth service, there used to be some doctors that prescribe particular commodities. We know what they are doing. Okay. Now, if you're not too sure and perhaps something is coming, you could just put it through AI and you can come up with uh, those anomalies and flag it and perhaps take action when necessary. How about inventory forecasting? You manage commodities, you manage drugs, consumables, and all of them. Okay. So you can use AI to forecast based on the consumption data you have. You can use it to forecast. Both even the service data, the data about the population, you can put it together and do forecasting. You know how many commodities or quantity of any drug or commodities that you need at a certain time to avoid stock out. You can also do to even take care of preventing stock up. There is a tool or I'm working with someone, and there's this idea that I'm working with called Medintel 360. It's an AI-based tool, and what is going to help us is to design that tool in such a way that we have feasibility from the facility so that we know which facilities around the state has drug, which one is stock up, which one has a drug that is almost expiring, 6 months to expiring, and so on and so forth. Which one is overstock and so on. Now, if we have that picture, we can now redistribute and ensure that no drug expires and no place is out of stock. Okay, so AI can help you in that area. Then how about dosage optimization? With machine learning, you can personalize dosing based on patient weight, renal function, age, and genetic markers. Of course, you're already doing this one. AI can help you do it better. How about automated medication reconciliation? AI can extract and compare medication lists across care settings and reduce transition errors. So you can do a whole lot of things in safety, prevention, compliance, operations, clinical, and even continuity of a system. Okay, that's AI for medication management. How about in clinical support? You can use AI as your intelligent colleague. Now, I tell people, especially students in my AI Mastery Academy, that they should not look at AI as a tool or as just technology. They should upgrade it to a friend, to a colleague, to an assistant. Yatafa is your assistant. So if you look at it in that format, you are not looking at it as just combination of wires and diodes or whatever. You are looking at it as something that will help you do your work. So if you look at it at that level, then you deal with it in that capacity. So diagnosis assistant, AI can help you with that. It can suggest differential diagnosis based on the symptom, the lab report, and even patient history. You can counsel appropriately when you are able to understand whatever it is that the patient has. Now, we have had incidents, reports where prescribers or clinicians have misdiagnosed a patient. Of course, it wasn't intentional, but because of their limitation as human, they are not able to see everything. But with AI, you are able to know what options are there, and if possible, what you could do to be certain about what it is, rather than just using your human judgment. So AI can assist you with diagnosis. AI can also help you with treatment guidelines. It can tell you evidence-based guidelines at point of care so that recommendations are current. I talked about new updates, new evidences, new drugs, all of them coming in. Currency. You want to be current. AI can help you with the treatment guidelines that are current, not archaic. Not people using 1960, 1970, 1980 prescription time. Okay. Then even when you have live lab value, lab result, you can interpret the value. You can contextualize abnormal results against patient complete medication and even disease profile. So it's not, you are not just looking at even the lab report only, you are looking at it in conjunction with the patient details. That will give you even a better interpretation. And that's AI at work. Then, of course, if your patient are in chronic disease condition, you can help with the medication review, you can help with monitoring, you can help with dose adjustment. You can even do adherence monitoring and so on and so forth, so that you have a proactive pharmacy service. Imagine you as let's even say a community pharmacy, and you are able to follow up on your patient, a diabetic patient, for example. You are able to get the person to take his drug regularly. You are able to get feedback on what they are feeling and so on and so forth. What do you think about patronage? What do you think about respect? What do you think about that level of trust, which is going to deepen? So with AI, you can increase your value, increase your capacity and your authority. Okay. Now, how about patient engagement? We deal with patient every day. Without patient, we are nowhere. What if you could design a medication reminder app? I mentioned earlier about your diabetic patient. So now you are able to remind them, it's 7 a.m., it's time for your drug. It's 8 hours later, you are telling them it's time for your drug. So you don't miss out. There are patients that you give them TIT or 8 hourly, and they forget. The next time they remember, it was already 12 hours. Okay. So what if you are able to input them into your system, and a reminder is coming to them and telling them it's time for you to take your drug. Okay? You can try adherence and get your patients to get better outcome with their treatment. How about chatbots, which you can use for counseling? There is 247 assistant. Answers common medication questions, screen symptoms, triage queries in local languages. So you can do it in English and even in local languages, Hausa, Yoruba, Igbo, French, or any other language that you want to use. And what does this do for you? It saves you time. Instead of patient calling you per second, they can discuss with your virtual self, your clone, in form of chatbot, and get those counseling that they need. And of course, you are the one that will have trained this chatbot with information that we need. And by the way, information is readily available. There are many websites that have this information that you can get the API and use it in designing. Now, about adherence monitoring with AI, there are wearables, there are smart P dispensers that feed data to AI system that predicts and prevent non-adherence. I talked about the reminder to help adherence. We also have wearables. Some patients have wearables. It can be in form of wristwatch, it can be in form of necklace, handband, or whatever, but it reminds them of their drugs so that they don't miss their drugs. And you can connect this wearable to a central dashboard, which when you see it, you are alerted and you can communicate with the patient and say, you have not done what you are supposed to do. What does that translate to? Better patient outcome. That's a better healthcare delivery. Is that not what we want as professionals? Then we have multilingual communication. I mentioned it earlier when I said local languages. You can translate instructions, labels, counseling into patient preferred languages automatically. Hausa, Yoruba, Igbo, Pidgin. We are going to use some of them in practical terms as we go on. Okay? All right. Now, in the Nigerian healthcare, what are the opportunities available to us? What are the realities on ground? Okay? We have a lot of challenges. We have a lot of challenges in Nigeria. All of us are facing it. Okay? We have shortage of staff. We have population that are so dispersed. So shortage of staff, AI can extend your reach. So you can reach a lot more people without seeing them physically with AI. Okay? I talked about chatbot. That's a way of reaching your patient without seeing them physically. Then we have telemedicine. People may be far away from anywhere they are, but I mean, you are watching this video. I'm recording right now this video in Uma here. You may be in Lagos to watch it tomorrow. Somebody in Ghana can watch, someone in the US can watch it. That's also another way of getting my reach, even though my target is dispersed all around. We have high burden of preventable diseases. You can bring in predictive AI to help you predict what is likely to happen, and you can quickly nib it in the bud. Then we have specialists, as we have limited, just like we have not enough physicians. It's worse with specialists. GPs can take advantage of that. Pharmacists, because you also have prescribing right, you can take advantage and close the gap using AI support. Then what are the opportunities? We have 120 million mobile users in Nigeria. Nigeria is a mobile first country. Before we do anything, the first place we go is our phone. Okay, so that's an opportunity for mobile health penetration. Okay, all these things we're talking about, chatbot, SMS reminder, WhatsApp reminder, telemedicine, all of them are mobile based. So if we have 120 million people with mobile phone, then it also means that these are the number of people you can reach to get the result, irrespective of education level. Remember, we talked about WhatsApp? And of course, you can create voice. A person that may not be able to read may receive a message, open the message, and a voice is speaking to the person on what you want to speak, if possible, in their local language. If you're not sure of the local language, you can rest it in Pidgin. AI can speak Pidgin. Okay. All right. Then NHIS is also undergoing digital transformation. So you also want to take advantage of that and align your organization, your practice to fit in. Then, of course, there are more and more healthcare startups coming up everywhere. My own organization, EdTech Innovation, is in that field, and there's nothing stopping every pharmacist from starting a healthcare startup. There's a market for all of us. 120 million people is a lot of people. 120 billion people is a lot of people. How many percent should you take? If you take 1% of it, that's about 120,000, or how many? Imagine that you have 120,000 customers. who are paying you maybe monthly. If it's 1,000 naira they are paying, that's 100 and that's 1.2 million. Oh, 120 million a month if each of them pay you 1,000 naira. And that's a lot. Of course, you are not going to start with the 120,000 people at once. As they grow, you keep growing. That's a market for you, a large market that you can take advantage of. Okay. And of course, in doing this, you also need to consider a few things: data privacy, electricity and connectivity. And one time I was talking to my student, I said, use AI to create things and create income so that you can make money to buy your own solar system. In my house, I have a lithium solar system installed, 247. I have light. I can wake up anytime and I do whatever I want to do online because there's light. It was not like before that you have to wait for NEPA to bring light. Okay, that's a challenge actually that we face. But what if you can make the money to solve that problem? I think that would be very interesting, right? Now, digital literacy gap is also there across patient population. So you need to understand your patient and know a way of bridging the gap. We talked about local languages, multilingual communication. AI can help you with that. And of course, there's a need for validation of AI too for African population. Now, in Nigeria, NITDA and the sister organizations are doing a lot of things in the area of AI policy to ensure that AI in use in Nigeria represents Nigeria. You see, there's something about bias. We want to talk about ethical AI. It is what the tool is trained on that it works with. So, it's for example, pharmacists, you are trained on orthodox medicine, and those are the medicines that you are familiar with. Even though we did some pharmacognosy, we are not too familiar with all type of herbal medicine. But if you're in China, which have alternative medicine, they are also trained in alternative medicine very deeply. So anybody that is trained in alternative medicine has a lot of knowledge about alternative medicine. Now, that's you as human, as a pharmacist. The same thing happens with AI. It is what it is trained on that is going to. So we need also to train our own AI. That's where the validation of AI tools for Africa population is important. And that's where our governments come in to ensure that things are done properly. So what are the opportunities available to you? What make AI possible? So what can AI do for you actually in short? It can help you work faster, so you can automate repetitive tasks. So if you are doing literature review, you can easily search for literature. If you are writing a report, you can write it very quickly. If you want to generate label for maybe your extemporaneous preparation, you can quickly generate it in seconds. How about information? If you want to reach information, get information, you can get it very, very quickly. You can query any drug database, guidelines, evidence-based conversation in plain language and very, very quickly. You can improve patient communication. I mentioned that again and again and again. And of course, you can come up with new ideas, new services. You can design new pharmacy service models, remote monitoring, adherence program, digital clinic. You see, we are familiar with the conventional. But we can create something new business models. Most of our pharmacies, what do? Community pharmacies, for example, they come to buy. What if you create a subscription? Or what if you create something, a hybrid or something? Maybe you don't even have the idea on how to do it. With AI, you can come up with these ideas that could help you. Okay? Now, if all these four are the things that they do for us, what are the benefits that come out of it? One, there's a reduction in your workload. So the work that takes you 1 week, you can do it in a day or less. The work that takes you hours, you can do them in minutes. So you see reduction of workload because the work is taken off your head. Improving patient care. So you're able to concentrate more on patient care, show that empathy, have that time with them, have that discussion with them, let them feel the humanness in you. That's what you gain when your workload is removed and you have better access to information that will help your patient. Then also you become more influential as a professional. You're able to give better guidance. You're able to give more informed decision, make more informed decision. You are able to contribute more in discussion, whether among professionals or even the general public. Because with AI, you can also learn more. Now, we talked about new innovations coming, new information, new updates, and many of them are not able to catch up, but you can summarize them. A paper, 15 pages, 20 pages journal, you can summarize it into how many? In into paragraphs. And you can read the whole journal in how many minutes? A minute or two. Okay? That's improving your knowledge, which you are going to be using for patient improvement and also to create influence as a pharmacist. And of course, new income generation. I talked about my own startup. We talked about there are other ways in which you can create new income. You can do your startups, you can create tools, you can create apps, you can offer new services, you can create new business models, you can write books, you can create flyers for people or for your organization. You can become a trainer. You can do a lot, quite a lot, as a pharmacist. Okay, so and which will give you a new income opportunity. All right. So we have mentioned this earlier that drug information, how AI can help you in your work. So it can help you with drug information summaries. So you can prompt AI to synthesize complex drug monographs, interaction profiles, dosing guidance into a concise, clinical ready brief in seconds. You can create patient education materials. We're going to see some of these things in action. Generate plain language medication leaflet, discharge instruction, FAQ sheets tailored to diagnosis, literacy level, and language. You can also do medication counseling. I created a tool that will help with this, but it's not robust. I just created it. We are going to see it in practical use. And you see one interesting thing, as I mentioned this, let me just mention a quick look. We are going to see some of those tools. You can create tools that ordinarily you will need a programmer to create for you. Now with AI, you can create a tool that you can use in your organization. It could be a tool for report writing. It could be a tool for counseling. It could be a tool for inventory management. It could be a tool for several different things. Okay, so here we're talking about counseling, but it can be for any different things. Okay, then you can create awareness campaign. You want to do social media posts, you want to do SMS health tips, community health messages for different disease conditions. You can use AI to create those work. Then in your organization, you can improve your workflow by automation. You can track prescriptions updates, you can track refill reminder messages, stock count summaries, monthly dispensing report, and all sorts of things. So we are looking at these 5. We're not going to do all of them actually, but I'm going to do a lot of things in the practical session so that you can see AI in action. And of course, it's not possible to teach everything in AI in an hour or two, but you are going to learn a lot. And of course, if you are able to take advantage of our other opportunities where we take deep dive into AI use as a professional, as a pharmacist, of course, you are going to learn a lot more that can make you stand out in your practice. And of course, make a lot of money. I don't know, I keep talking about money. Money makes things go around, right? All right. So, want to be the future pharmacist? Who is he? Or who is she? The future pharmacist is AI enabled. Whether we like it or yes, AI has come to stay. AI is competing with us. Those who are using AI are going to be better than those who are not using AI. So AI increase competitiveness. So the future pharmacist is going to be AI enabled. And if it's AI enabled, he or she will not be replaced. And if he is not replaced, it means his value, his or her value, productivity, efficiency, income will be enhanced. Okay? So with AI, as a pharmacist, you get more power to serve more patients at higher quality with greater professional authority. I think this should excite us as pharmacists. With AI, you can serve more patients because those things that take your time are taken off you. So you have enough time. Then you are able to even give them high quality because now you can easily access premium information. You are able to learn and inform yourself with new information because with AI, you can teach yourself and learn a lot and get access to new information. Then your professional authority will increase. Once again, this should excite us as pharmacists. Okay. Now, I want to introduce a framework for using AI, okay, as a pharmacist. I call it AIRE Framework. AIRE Framework. AIRE. What is A? Assess. What is I? Integrate. What is R? Reimagine. And what is E? Expand. Now, I used to see some adverts that says, learn AI in 15 minutes, in 28 days, you will be the most dangerous person in the room. Of course, those tools that those organizations are teaching are very important tools. They are very useful tools. But the challenge now is this. If you learn a tool, how do you use it? If you learn a tool, is that tool useful in your own circumstance, in your own practice? So why learn 30 tools when you actually need 5 tools? Why learn 30 tools when you actually need 5 tools? And that's why my own framework is different. My framework talks about assessing opportunities. Map your daily task. Find where AI saves time, reduces error, and elevates quality. So you want to find out, what do I do? In which area can AI help me? Once you have identified those areas, then the next thing is to integrate AI tools into those work. So you look, what are the validated tools that are available? Then you start using them gradually, building habits on using them, and embed AI in your workflow. That's now when you need to learn AI tools. And when you are learning AI tools, you are going to learn AI tools that align with what you do, what you want it to do, the result you want to get, the outcome you are looking for. And now, once you have learned that these tools can work, then you go full-fledged. That's now you now design services that didn't exist before. I mentioned about creating some tools. You can create new workflows. You can create different things in your organization that will make work better. Now you have a problem, you have identified the tools, now you have created a system. That's where Reimagine comes in. So you can create a new system that will help your work get better. Then, once you are already building and you are enjoying it and you are getting the best out of it, of course, you want to share with other colleagues. You want to expand, share your expertise, mentor your peers, mentor your junior ones, and build your own AI reputation. Tell me, what if you are the one teaching this? What if you are the one teaching this? And there are a lot of people that you can teach. So how do you get to that? First, getting that expertise developed, starting with assessment, integration, and reimagine. Then, of course, you can now expand to other people. Okay. So if you're talking about assessing opportunity, which I mentioned earlier, adoption without assessment leads to random tool use. You don't want to use tool randomly. You can not, okay, you have learned out image creation. You begin to create different kind of images. And these images are not even aligning with the work you're doing. So if you don't assess, you do random usage of tools. Okay. So with proper assessment, you are able to make better choices of the tools to use to solve a particular problem. Then by the time you integrate, you move from theory to practice. Structured adoption prevents mistakes and build your confidence. Then once you are moved that, just like I said, I'm just trying to repeat for emphasis why you should do what I ask you to do is at this level of reimagining services, you separate practitioners who use AI to do old things faster from those who use it to do new things altogether. Okay? But one of the things is you can use AI to do what you regularly do. It's still part of the imagining process. However, you can also use AI to create new things. Remember, we talked about coming up new pharmacy services, right? New business models and stuff like that. Both of them fall under the category of imagine. Because the first thing is you want to use AI to do regular things. Then you begin to say, what else can I do with AI? What new things can I do with AI to improve my practice? Then for expansion, I mentioned the professional influence, it multiplies who you become. You become that pharmacist that other people are looking up to. You become that person in your community that, when it comes to this, they come to you. Okay? So if you use the AIRE framework will get you to get the best out of AI. And I think this is better than just learning tools as it were. Okay?